Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 017. A 25-year-old woman was brought into the gynecological department with profuse bloody discharge from her genital tracts. She is 12 weeks pregnant. The pregnancy is planned. Within the last 3 days she was experiencing pains in her lower abdomen that eventually started resembling cramps. She developed bleeding. Her skin is pale, pulse 88 per minute, blood pressure 1/160th of a millimeter Hg, body temperature 36.8 degrees C. Vaginal examination. The uterus size corresponds to 11 weeks of gestation. The cervical canal allows inserting one finger and contains fragments of the fertilized ovum. The discharge is bloody and profuse. What is the most likely diagnosis? A. 12-week pregnancy, spontaneous abortion in progress. B. 12-week pregnancy, threatened spontaneous abortion. C. Full-term pregnancy, term labor. D. Disturbed menstrual cycle, amenorrhea. E. Disturbed menstrual cycle, hyperpolymenorrhea. Spontaneous abortion, miscarriage, is the loss of pregnancy naturally before 20 weeks of gestation. Late spontaneous abortion may begin with a gush of fluid when the membranes rupture. Hemorrhage is rarely massive. A dilated cervix indicates that abortion is inevitable. Symptoms of spontaneous abortion: crampy pelvic pain, uterine bleeding, eventually expulsion of tissue. Early pregnancy loss is the loss of a pregnancy during the first trimester, 0 to 13 weeks. The first trimester is the most crucial to the baby's development. During this period, the baby's body structure and organ systems develop, where most miscarriages and birth defects occur. Types of early pregnancy loss: threatened abortion, symptomatic, threatened expulsion of the products of conception, yet the cervical os remains closed, and the embryo or fetus remains viable. Missed abortion: there is asymptomatic or missed death of the embryo or fetus without sufficient uterine contractions to push out the products of conception. A fetus is no longer alive, the fetus does not form or is no longer developing, but the body does not recognize the pregnancy loss or expel the pregnancy tissue. The placenta and embryonic tissues are still in the uterus, and the cervical os is closed. Inevitable abortion: the presence of an open cervical os, indicating the inevitable passage of the conception products. Incomplete abortion: there is an incomplete passage of the products of conception through the cervical os. The products of conception are partially expelled. Complete abortion: a complete passage of all conception products. The products of conception have passed and the cervix is closed. Recurrent abortion: 3 or more consecutive pregnancy losses. Septic abortion: retained products of conception become infected, which usually occurs in the setting of non-sterile induced abortion. The answer is A. 12-week pregnancy, spontaneous abortion in progress.